The buy-in process for a high-value care committee or structure varies depending on the stakeholder. It's easy to gain alignment and engagement in the laboratory environment because the laboratory, whether it's the technologist, the phlebotomist, the pathologist, recognize that why is this test ordered so often? Why was this test ordered again? Why was blood drawn, when it really didn't need to be? So the buy-in for them is easier to understand because they see a waste of resources, an excess of utilization, excess blood that was drawn that was never used again. So the buy-in for those stakeholders is an easier opportunity. For providers, when you share data with them, sometimes it's an eye-opening event. I never realized that in my patient during that hospitalization, they had 4 of that same test that only needs to be done every 30 days or every 90 days. Sharing data opens their eyes and lets them see, I didn't know that we were doing that, or I didn't know I was using the wrong test, or I didn't know I was using the wrong culture technique in order to give me the best results. I didn't realize that a cotton fiber tube or cotton fiber swab would result in a poorer yield than actually drawing fluid or tissue from the site. So we brought in Healthcare Forward and HC1 to help us with this process. And many systems will complain, and we heard that from several different discussants, how their software package, their laboratory information system, can't measure data adequately. Whether it's an Epic system or a McKesson system, we've just engaged with Cerner for the McLaren system. We're not sure how that will do with data aggregation and being able to manage or to monitor laboratory utilization. But HC1 has a powerful tool. They have a strong tool for aggregating data, collecting data, and very granular data down to the which physician ordered which test on which patient at what time. And they were able to do it in the McLaren system that has 3 separate interfaces.